Move on to item 8.10, approval of the Mason County application to move to Safe Start Phase 3. There's been a name change.
Yes, there has been. All right, Commissioners, I'll take a few moments just to go through the application packet and process. As you know, move from Phase 1 to Phase 2 was the first time we've done anything like this, and that was, of course, that was a variance. This is actually just an application, so they did change the terminology on it. Moving from Phase 2 to Phase 3, in your packet on the first page, you'll find a letter from me to John Weisman, who's the Secretary of Health, basically in a very short outline the plan for Mason County moving forward into Phase 3. The takeaways on this are our continued focus on keeping people safe while moving the economy ahead, number one focus on all things we do. Noting that there's no industry-specific guidance beyond what's already on the DOH website that we're expecting. So moving forward, we'll be using the business opening template for all businesses not specifically referred to in industry guidance. Our timeline will be, we'll move into Phase 3 not earlier than 22 June 2020 or 48 hours after the official approval notification from DOH. That gives us the ability to move to Phase 3 next Monday and open our county-facing offices, unless DOH pauses that and doesn't get to it until the weekend. So it gives us another 48 hours after the announcement from DOH for us to make sure that all notifications go out. We're putting together a notification package this week through the Joint Information Center, which will go out through our public information channels that will outline and make it very clear that we're applying for Phase 3. We're not in Phase 3 until we get the authorization from DOH, and then we'll, as soon as we get that authorization, then we'll publish the timeline and the date. So that's the first page. Also on the first page you have the Safe Start template, and it's available online. So again, businesses that don't fall into those industry-specific pieces can use that. And that's also for nonprofits, clubs, those sorts of organizations as well. They can do the business template. Not everything will apply to them, but they can use that to fill out to make sure they have a COVID plan in place that's acceptable should anybody, L&I or somebody inquire about it. So it keeps our local nonprofits and clubs safe. The second piece is the actual request for variance, and we're still using the same language. Statement of purpose, we talk about the Mason County population and the need to go into Phase 3. We talk about the most vulnerable populations and preserving our capacity in our healthcare system. So at the bottom of the page you have the metrics that are posted by DOH, and we are good to go on all 5 of the major criteria that DOH is looking for. So we have yeses all across the board. Going on to the next page, you have the Mason County application for variance matrix. This is just a distilled version of the whole document under one page that shows the targets we're trying to hit and then where Mason County stands. So for example, in COVID activity, we're looking at a target of less than 25 cases per 100,000 per 14 days. And where we're at, our crude rate is at 4.6 cases per 100,000. So we are very well underneath the threshold. Healthcare system readiness, we're at 68%. The target's 80%. We're looking for 1 positive per 50 tests. So and we're averaging about 100 tests per positive case. So we're well under that as well. We're reaching all of our goals on case contact and case investigation, and typically we have those resolved within 12 hours. The standard is 48 hours, and we typically have those done within 12. So and then after the 12 hours, we continue to contact those contacts daily to make sure that they have the means to maintain quarantine or isolation. So and we follow those throughout the course of the disease and until they're through. So our staff is on top of that all the time. Moving on, we have the epidemiological curves, and it shows how we had our spike really back at the very end of March, first part of April, and we've been pretty flat ever since. We're averaging about 1 case per every 4 days, so we're well within our capability to react. The application narrative starts on the next page. Shut that off. So we've had no deaths since Phase 2. Basically, all this data is collected around what has happened since the beginning of phase 2. I did throw some things in that went back all the way to the beginning of the COVID timeline, just as a counterpoint. So we've had no deaths since phase 2. We've had 1 hospitalization. We've had 2 cases, 1 family, and 1 other. So since the beginning of phase 2 until the timeline when this was put out, which was the 13th, we had 3 cases. Since then, we've had another case. No ongoing outbreaks, and then we are asked to do a description of the time from onset of symptoms to getting tested, and the numbers are so low we can't calculate a median that way. So we maintain our testing capabilities. Mason County has Mason General Hospital doing the drive-through testing. They've also added BioFire to the system, so they're able to do rapid tests as well. And those are very helpful for nursing home patients who have been in the hospital for some other reason, need a clean test in order to go back to the nursing home, so they're able to use BioFire, get them a test right away, and get them discharged to the nursing home. It's been a great addition to the community. Median number of days, we've covered that. For each of the weeks, so we've had 3 weeks. We've had 1 positive test the first week, 2 the second week, 1 the third week. So it gives us, out of 680 tests, we've had 0.5% cases positive. Again, we're well underneath the thresholds. We then go on to describe in some detail our ability to react to outbreaks. So at this point, at the point I wrote this a couple days ago, we have 15.2 FTE who are trained investigators. We've since added 2 more who went online and took some more testing. So actually we've increased our capability. We also have an MOU going out to DOH at the bottom of the next page, reliance on DOH sources. We've had a number of discussions with John Weisman about what we would do in the event of an outbreak, because we've been at this a long time now. The nurses have been working weekends, evenings since this began. DOH had a phone call with us last week to determine what the actual numbers we would need for case contact, and should we have to stand up our alternate care facility, or if we have to stand up building 10 for quarantine and isolation, what those numbers would look like for non-medical personnel. We're getting agreements on who we would get and how soon we would get them. So DOH was very impressed with asking for an MOU that would solidify their response in a request to a Mesa County call for assistance. So that's going well. We should have that by the end of this week. Facilities used, we discussed that in some detail. We begin to talk at the end of that about the community Lifeline homeless shelter, where we added 30 beds. And with the addition of a sprinkler system, as you voted on earlier, we have the ability for them to meet fire code in order to move to year-round, if necessary, homeless sheltering. And we've had homeless sheltering there since COVID started. We've extended it. Normally they end the 1st of April. We extended through April, May, into June. And we've had no outbreaks within the homeless community. So I think that has been very successful by getting people in and making sure that they had a good place to go. They had food. They had a way to separate themselves. That I think was very successful in keeping that disease out of that particular population. We do talk about in-home isolation. So if we have people who are need to isolate at home or quarantine at home, there are resources. One of the things that has leapt to the forefront is if we have people who are low income and they feel they need to go to work in order to pay the rent or to pay their food bills, there is money available for us to step in and pay the rent and pay for food so those people can stay home for their 14 days and ensure that we get through the quarantine process and people can get back out and get on with their lives. Again, we address outbreak investigation. Very important as we go into phase 3. Our planning efforts will shift from getting us into phase 3 into looking at what we'll need for the fall in case, with the possibility of schools opening, what does that look like? And then should there be a resurgence, how would we deal with that as well? So that is the planning method from here on. Again, we go to the Mason County Plan, which just reiterates the first page of the letter. We go to hospital data, which shows the hospital use of PPE and their maintenance of that. Next chart shows there's a new system now called Law Health that the hospital inputs their data into every day about how many masks they have available, gowns, all those things. And as you see, we're the hospital is definitely hitting the numbers on that, looking very good. The following page looks at the system at a glance. You know, what are the percentages of beds and bed capabilities that we need, and we're meeting those. At the bottom, you see we put in a chart about our disease activity since the beginning of March. We had our peak again in early April, and now we're basically at, it shows 4.6, but right now it's dropped down to 3.2. I did not put that in there because that's not the authorized number at this point because DOH hasn't finished reviewing that. And then lastly, in the packet itself, we look at our bed availability, and we had a spike there at the hospital, a spike of 1, and now we're back down to 0 people in the hospital with COVID-like symptoms, or COVID. People can be in there with COVID-like symptoms until they're identified whether they do or do not have COVID. So we had 1 that was positively identified in the hospital with COVID, and that person's been released. We do have the next piece, which is a letter from our health officer, which this whole thing is pinned on, is the health officer recommends for us to go forward first. We put the plan together, we've got the letter there. We have a letter from the hospital, so the 4 things that we require in addition to the plan is a letter from the health officer, a letter from the hospital, and then resolutions from both the Board of Health and the Board of County Commissioners. The Board of Health reviewed this plan this morning and voted in favor, so this is the last step in the process. If you approve this plan, we'll remove the draft, clean it up just a little bit for nice electronic transmission, and submit it this afternoon. Being clear, we're not in phase 3, we're applying for phase 3.
Okay, thank you. Any questions?
Yeah, Dave, appreciate all the work that went into this from you and staff and our outside partners at the hospital districts. What would look, for the average citizen resident of Mason County, what would look different between phase 2 and phase 3 as they go out and about?
Really, phase 3 is an extension of the release done in phase 2. So you'll have an increased capacity for restaurants, for example, go from 50% capacity to 75% capacity. Theaters, walk-in theaters may reopen at 50% capacity, and then the drive-in theater was already open, so it opened several weeks ago under a phase 2, so that's doesn't change that much. We are withholding with the county the ability to not authorize pools and spas to go forward without, we're going to take a further look at that and bring that back to the commission, as well as county-owned ball fields. We're authorized to go to 50 people per ball field, but we have several of our facilities that have more than 1 field, so it's a question of, do we have enough people at this time to manage those fields at 50 people per field? Because we have the complex that has 7 fields, we can have 350 folks there. And then what do we do about the common areas? So we're reserving that in our application to say we will address that in a second step on this process. We'll bring that back to the County Commission once we've worked with our Parks and Recs folk, and then Public Health as well, to make sure that our pools and spas get their inspections done prior to reopening.
So will you handle pool and spa opening on a case-by-case basis?
Right, I think our staff's already working on those, so I think some of them will be ready to go right away, but we'll come back to the commission with an update on that.
Okay. Thank you.
Have a motion?
Yep, Madam Chair, I move for approval to move from Safe Start from 2 to phase 2 to Safe Start phase 3 as presented.
Second.
Okay, we have a motion and a second to approve Mason County application to move from Safe Start phase 2, their variance phase 2, to Safe Start phase 3. Oh, any comment?
Yeah, for those that, I get contacted a lot of people, some people were upset and wanted to automatically move into phase 3 on the 3rd week. It just doesn't work that way. For many, I'd like them to know that, but I'd also like them to know why I didn't just fight and push that we have everything set up so that we can go on the day that we were finally allowed to turn it in. There's a lot that goes into this stuff, and when your staff and your doctor is recommending that we have an opening date at a certain time so that they can put all their pieces together, roll it out in a way that will keep people safe, that is the smartest and best way to go. I'm not the mayor of Seattle or New York, the governor of New York. Our job is Mason County, and our job is to protect the people here and make sure it's safe. On a personal note, I follow the stats all the time, and one of the problems that I've been waiting for and watching is the 2 weeks. Because immediately you had people that were saying, oh no, it was blowing up because as soon as they approved it, people started getting sick. Well, it takes a while for you to even know if that's even happening. And the way the state's statistics run, they actually have a window where it's pretty gray. And so you could have 14 days, but you don't actually have 14 days of information. You have to go another week to even get to that point. So I just wanted to make clear, it was a situation where I personally thought it was better to measure twice and cut once. I didn't want to play catch up on this, so that's why I didn't fight for or try to get us to open earlier. And I think our staff is correct to do it in the way that we're doing it. So I want to thank you, and for those at home that are getting mad, my apologies, but again, I still think it was the right thing to do to wait until the proper time and what was recommended by the people that we pay a lot of money to know these things for.
Yeah. No, I do want to thank staff and you and the EOC, and there's a lot of players in this, and it's very appreciated. So, thank you.
Thanks.
Thank you. All right, so now we have a motion and a second to move forward. All in favor?
Aye.
Aye.
And we're approved. Go forth and send.
Okay, thank you.